Facebook Live is on.
We're good.
Here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is our website. Check it out. I'm here today with Richard. What's up, Richard?
Hey, how are you doing today?
Bite size. Or
Bite size,
medium, no.
medium large.
Inside joke. But anyways, Richard's a patient over at Buckeye. He's doing hormone replacement therapy. So we're going to talk about that a little bit today. He had a big accident. We're going to talk about that a little bit. So it'll be an interesting show. So we're going to cut the break and we'll be right back.
Okay. Boom. Here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. Check out our website, BuckeyePMR.com. I'm here today with Richard. What's going on, Richard?
I'm good. How are you doing today?
Yeah,
Thanks for having me on.
Yeah, thanks for coming down here, man. I
No
appreciate
problem.
it.
Appreciate it.
So I'll talk a little bit about it. So it's radio, so people can't see you. How old are you?
I'll be 46 this year in
Okay.
August.
And you were telling me ahead of time you were actually training for an Ironman. Tell me.
Correct.
Had you done like I know the shorter ones, like the sprints and all that stuff?
Yeah, I've done the sprints, the Olympic. I've done a couple of the halves, the 70.3. So, the natural progression is to say, hey, I'm going to try the Ironman.
How many years were you doing that for?
On and off, probably for about 10 years.
Oh, wow. So this is something.
Yeah, it's like a lifestyle, if you will.
Okay.
Just something I really enjoy. In 2016, I was training for Ironman Louisville.
An Ironman, just because people don't know what it is. So what is an Ironman?
An Ironman is a race that involves swim, bike, run. The swim is 2.4 miles. The bike is 112, and the run is a marathon, 26.2, for a grand total of 140.6 miles. And you have up until midnight to finish.
So you're doing a marathon, riding over 100 miles, and swimming 2 miles in one day.
In one day, 17 hours of glory.
Wow, that's crazy. Okay, and this would have been your first one because the
Yes.
shorter ones are what? Like what are the half ones? That's basically all those distances cut in half.
Cut in half. Like a 70.3 is 1.2 mile swim, 56-mile bike, and then half marathon, 13.1.
Got it.
Which it's still 70.3 miles.
And
Could be a long day.
Just out of curiosity, when someone's training for this, is this something you train for every single day? Like you either bike or swim or run or?
Yeah, I used an app called Training Peaks, and basically you put in there what you want to do, and you pick a program, and it'll come up. It'll say, hey, Monday, swim, blah blah. You have 1,500 meters will be your big set or your long set, and then followed by a cool down. Tuesday could be a bike or a run.
You don't know until you open the app.
Well, you can
For
actually
the week, you can see it for the week what you got.
right for the week, so you'll know. So, but it's basically 7 days a week for sure.
Yeah, awesome. So, you're training for this Ironman. This will be your first one, and what happens?
I was on my last long bike ride.
And what's a long bike ride?
It was a 5-hour bike ride, so it was around 90 miles, and was on my way back to my car. I was in high gear. I was tired, was hungry, wanted to get back to the car. And long story short, I had a toddler that ran out in front of me on my bike, and I basically had time to hit my brakes, flipped over the bike, broke my collarbone, which now I have a nice plate and 8 screws, and wasn't able to do the race.
Wow.
So, and that's what I'm basically trying to work back to is...
How many weeks before the competition was that?
4 weeks.
Wow.
So
That's
I
a bummer.
basically, that long bike ride would have been my taper. After that, it was just, maintenance
downhill.
miles, if you will. And then, showing up on race day and
Getting it done.
hopefully crossing that finish line and getting that bling, as I like to call it. So,
Mhm.
yeah. But that's what I'm trying to get back to now.
Awesome.
Is it
And
still
when was
my
your
goal?
accident was when?
Was in 2016.
Okay. So a couple
So
years
it was
ago.
in September of 2016. The race was the end of October. So...
All right. So how did I think you got to us non-traditionally. I think you were going to the office for some of the injuries from the accident. Was that
Right,
correct?
just trying to get back on track because I could tell like my back wasn't right and having headaches, just things like that. Because I've always been to the chiropractor because I think it's very beneficial. Was feeling good and they were like, hey, have you ever thought about trying the HRT? And I said no, and went in there, had a quick conversation, and I actually told the gentleman that sold it, I said, this is going to be the easiest sale you have in your life. And I basically told him, what I had been through, and just something I definitely really, really wanted to try. And now I'm really reaping the benefits from it.
That's awesome. So you got blood work done at the office, and
Yes.
it came back, and do you remember what your levels were? Were they?
My test was pretty low. And then they also were saying like my estrogen or whatever was also not where it should be.
Yeah.
So we kind of started off on a higher dose of the test, and then now it's starting to even out, and definitely feel like I found a fountain of youth, if you will.
That's
So,
awesome. That's
I mean,
awesome.
I'm starting to feel really good. Definitely a lot stronger.
How about your injuries? I mean, you had aches and pains. I always tell people, aches and pains seem like they get better with you. What people don't understand is, testosterone in particular is a really strong anti-inflammatory. So when people have lower testosterone, they don't recover from injuries as well. They have just more aches and pains, on top of the other things, lack of drive. But the aches and pains are something that really benefited most people. Did you notice?
I have noticed that. To be honest, well, having my collarbone feel the way it felt. Here, this last time I went to the gym, I was actually able to do the 90-pound dumbbells, something that I haven't done in almost 2 years, to be honest.
Awesome.
And it's starting to feel a lot better because I was very timid, very scared. I was like, I'd put like 135 pounds on the bar and be like, I'd do one rep and be like, I can't do this. And
Because
now
of pain or because of...
Because it would, it would be irritated, inflamed, if you will. And now that I've noticed, I think this is my 14th week that I've been doing the test.
We usually say it takes people,
Yeah.
on hormone replacement therapy, it takes a while to dial it in. There's no cookie cutter on this thing. So I usually don't expect anything for about 8 weeks. And at 8
Correct.
weeks, we have an idea, and then sometimes we end up tweaking. I don't know, did they tweak your dosage or?
Yeah, I think we went down on the test, and they gave me a couple of pills to take for the estrogen, and then I'm probably coming up for another blood draw to see if we got my
Right where you
levels
need to
where they
be.
need to be. Yeah, but I definitely can tell a humongous difference.
What were you experiencing before? So what were your
Just-
warnings?
I don't want to say lazy, but like very unmotivated. Like I'd go to the gym and be like, whatever, man. You know what I mean? I might do like
That's lack of drive, And
Yeah.
a lot of people, I think, unfortunately, they just chalk it up. I'm just getting older, so I can't work out like
Correct.
I used to.
Correct.
And it doesn't have to just be the gym. We talk about the gym a lot on here, but I mean, maybe it's riding a bike, maybe it's jogging. And what happens as you get older and don't have hormones, you don't have that drive, you just don't feel like doing it.
correct.
So then, and obviously we all should exercise at least 5 days a week, whether it's a gym, bike ride, walk your dog, something. When you lose that drive, your health steadily declines. And if you don't have your health, you don't have anything.
That's true.
Right. And unfortunately, so many people just, define themselves as getting older. And that's just not the case. There's no reason you can't be in your 40s or 50s and be in your lifetime best shape. There's no reason.
Oh, that's very true. I mean, like I said, I was chalking it up to feeling lazy or being lazy, and it was just like, now that I've been doing the HRT, I'm getting my drive back. I'm getting to like, where I want to be like, hey, I'm going to go out and ride my bike now. I'm going to go run. So basically all the things I was doing before, I'm starting to get back into,
Awesome.
and it feels good. So I'm super excited.
That's awesome. So when's your Ironman? When are you doing this thing?
It'd have to be next year.
Okay.
Because I mean, I'd have to, put in the time, put in the work, but it definitely has to be Ironman Louisville. So.
That's a good one. That's a good
Oh
one.
yeah, I definitely, going through that, and I just want to go back there and just be like,
It's a cool Ironman to do
finally
too.
did
It's a pretty town. They do it right down by the river. Walk down
It
there.
is. They say it's actually one of the best finishes on the circuit is downtown Louisville. So, but I'm definitely looking forward to it. Definitely looking forward to putting in the work. And like I said, I wish I'd been doing this in 2016. It would.
Did you notice back then when you were training? Were you lacking some drive back then, or are you just so focused, or what I'm saying? Because like I always tell people, and maybe you can expand on this because you're the patient, but sometimes you don't know how bad you feel until you feel right again, because male hormones decrease about 3 to 5% a year. So it's like the do you ever hear the boiling frog analogy? If you put a frog in water and you turn the heat up, a frog doesn't realize the water's getting hot. Next thing you know, they're boiling and they're dead. It's such a slow, you know what I'm saying? So, and guys are the same way. Our hormones decrease so slowly over time, you don't realize how bad you feel until you correct it. Now, females don't have that issue because they have this thing called menopause.
Mm-hmm.
So females kind of they just get thrown off a cliff,
Right.
and they know hot flashes, lack of energy, moodiness, weight gain, all that stuff. But guys, it's a slower process, which is almost more dangerous because you'll ask people, how do you feel? And say, oh, I feel all right. I mean, and really the question you ask is, how do you feel now compared to when you were in your 20s?
Mm-hmm.
Because that's what your scale of reference. When you're 20s, that's when you have the most energy, most libido, most mental focus, your most drive. And that's when you're healthy. That's where you want to be. Less likely to have diseases and all this stuff. So if you're listening and you're like, well, I kind of feel all right. I mean, how do you feel compared to when you're in your 20s? And if the answer is, well, yeah, I'm not as focused. I don't have the drive. I have more aches and pains. It's not because you're getting older. Your body doesn't wear out, but your hormones decline with time. That's
Right.
what happens to you. So now so what do you notice difference now? So you compared to before?
Definitely a lot more energy. Sleeping better. Definitely, like I said at the gym, I really do feel like I'm 10 years younger. I mean, I'm doing weights that I was doing before I got hurt with the collarbone. Definitely my focus and everything is coming back. And I feel that, back in 16 when I was training for the Ironman, it was, hey, get up, go to the pool, 2,500 meters, and then go to work.
Dang.
You know what I mean? So I was, and
How
it's,
many hours a week are you training? I mean, that's a serious commitment.
it depends. On the short weeks, maybe 10 to 12 hours, but on the long weeks, I mean, you'd have, a Saturday where you do a 3-hour run, and then Sunday you may do a 3.5, 4-hour bike. And then Monday was quote unquote your rest day, but that was 1,700 meters in the pool.
Wow, that's crazy. That's crazy. And I always tell people too, the blood work doesn't lie. So not everyone needs hormone replacement therapy, but what we do at Buckeye is, if you think you might need it, come and get your blood work done. Because if it's not wrong, we don't mess with it.
Definitely.
But if it's decreased, then it's something you should address. And it's completely safe and effective. I know you had mentioned you had a health scare before you got on the program. This is kind of a crazy story.
So 2017, I'm sitting there at the Blue Jackets game with my girlfriend.
This is right after the crash too, so you're messed
Right.
up collarbone, not feeling good.
Just sitting there, and the day before work, I kind of felt weird. Just kind of felt fatigued, and it's just like, man, what's going on? And long story short, come to find out, I had they call it deep vein thrombosis.
Yeah, DVP, yeah.
So I had a blood clot that basically, passed through my heart, and my cardiologist told me that
So you had this guy here who does training for an Ironman, the healthiest guy in the world, or
out of the blue, no rhyme, no reason. I can't tell you how many times they've pulled my blood work, and they, it all comes back normal, which I don't know how it could be if I had so now I'm on like Xarelto.
Mm-hmm.
So they just have me taking Xarelto every day, as a precaution, because they really don't know why I got this.
Right. You said maybe because of the crash that was pretty traumatic, maybe something from that.
Yeah, and see, that's what I kind of thought too, but, the doctors were saying that it had been too long of a time period in between. So, but to me, I kind of look at it like, hey, maybe in 2016 I was actually training for my life, if you will, but I didn't know that until the blood clot came.
Right.
So, but now it's all about, being as healthy as I can be. I'm still going to be active. I mean, I'm still going to do the Ironman. It's still my goal.
Mm-hmm.
And the HRT is really, like I said, I wish I knew about this 10 years ago, because the way I feel now, I mean, I really feel good. I feel strong, and I'm glad that that I went to Buckeye and they were like, "Hey, give this a shot." So it's.
How long did it take you to notice the difference? Would you say?
I would say probably right around week 10.
Okay.
But here, these past couple 3 weeks, I mean, I've felt really, really good. I can definitely tell in my collarbone it's not as inflamed, because I'm able to do, like I'd said before, I mean, I'd
Put some
grab
more weights on and do what I
40-pound
need.
dumbbells and do 2 reps and be like, oh, okay, I'm done. And now it feels so much better. Like, my body feels better. Like, I wake up every day and I'm like, man, I slept really good last night. I feel good. So I'm starting to feel like I did when I was younger, if you will. And even, a huge difference from 3 years ago, 4 years ago.
Mm-hmm.
It's awesome.
Yeah, and people, in simplest terms, people, what are hormones? Well, your testosterone, estrogen, progesterone, growth hormone. These are all part of your endocrine system. And the purpose of these hormones, if you want to keep it simple, it's how your cells communicate with each other. And the cells are what make up your body. So the analogy I like to use is you could take, Navy, 50 Navy SEALs. These guys are highly trained and throw them into combat. If they can't communicate, can't use hand signals, walkie-talkies, anything, how effective are they going to be? But not.
Not very.
So the same thing happens with people as you get older. Your body doesn't wear out because of time, but with time, your hormones decrease. Mm-hmm. And when your hormones decrease, your cell or your body can't communicate with itself. So, so what happens is you don't recover from injuries, you don't have energy, you have brain fog. These are all things that are 100% completely reversible and treatable, and it's safe. And there's tons of research out there. Now, the way we do it at Buckeye is we only use bioidenticals. And just to be clear, not all hormones are bioidentical. There's lots of synthetic stuff out there that we will not use at Buckeye. We won't prescribe them. But bioidenticals are simply replacing what your body no longer produces with the exact same molecule, the exact same thing, and supplementing it and getting it back to where a normal 25 to 30-year-old healthy male would be, or female, that is. And a lot of people say, well, I'm on hormones, but I don't know if they're bioidentical or synthetic. Bioidentical hormones don't even come with a warning label, because there is no, you can't, there's no side effects when done properly. So if you're taking a hormone and there's that parchment paper with a bunch of warnings, it's not a hormone, it's a drug that mimics a hormone. And there's lots of them out there. There's Premarin, there's Provera. These things are junk, they're synthetic, they cause cancer and lots of other conditions. Bioidentical hormones do not cause side effects. Now, I will tell you, you can overdose or underdose bioidentical hormones, but that's why at our office, you're getting blood work done. I think you start the program up, we do blood work at 4 weeks, and then after that, we're doing them until we got you perfect. It sounds like we're still kind of maybe manipulating yours a little bit, because we tweak some stuff, because there's no cookie cutter. You can take 10 guys or 10 females, the exact same body weight, exact same hormone levels, and their blood works would have totally different dosages. So in the beginning, it takes a minute to get you dialed in. And that's why it's essential, if you're going to do bioidentical hormone supplementation like we do at Buckeye, you go to someone, and that's what they specialize in. That's what they do. A primary care physician cannot manage a case like this. There's too much work. They're not set up for it. Your urologist, they don't specialize in this. Your endocrinologist, they don't do anti-aging. And I can't tell you, I had a guy come in yesterday. He's like, yeah, I went to my doctor. He was getting a testosterone shot at his doctor's office every 2 weeks. But he's like, my levels are too high, so now I'm going every 3 weeks. It doesn't work that way. Like, these injectable bioidentical hormones last 7 days at longest. So if you're doing an injection every 2 weeks, you're better off not even doing it. And this guy was going every 3 weeks because the guy was overdosing him with the 1 week shot, which made no sense. And this was a urologist. So, and not saying all urologists are bad, but if you have a heart problem, you go see a heart surgeon. If you have a kidney problem, go see a nephrologist. If you have a hormone issue, you go see someone who specializes in it. And that's what we do at Buckeye. Dr. Bain and myself are both diplomate trained in anti-aging. This is what we do. When you go to the office, that's what we do there. So but it's very important to get done properly, and it's actually unsafe not done properly. Synthetics are unsafe. We talk about topicals. You never took any topicals, but topical testosterone for males is dangerous. So if you're sitting here, but it's covered by some insurances, although that's not really covered anymore. They're kind of getting rid of that. But a lot of guys will go to their primary care. Hey, listen to Dr. Buzz on the radio. I might have low T. They'll prescribe them the topical stuff. Well, topical testosterone is bad for multiple reasons. Number one, for guys, it's too weak. It's not going to get you to Ironman status. I'll tell you that right now.
Right.
But the two other reasons is topical testosterone. When you put testosterone on the skin and it touches hair follicles, and all guys are hairy, it converts to this thing called DHT, which is dihydrotestosterone. And DHT can cause your hair to fall out, which some guys don't care, and that's whatever. But more important than that, it causes your prostate to get enlarged. So and guys don't want their prostate enlarged. The majority of men over 70 have prostate issues. So why would you take a supplement with topical testosterone that causes your prostate to become enlarged? And the other thing that happens with topical testosterone, and the thing that really drives me crazy, is it causes your estrogen to raise a lot. In managing your estrogen, and it sounds like we've been tweaking with yours a little bit too.
Yes.
Topical testosterone converts to estrogen at a very high rate. And I can't tell you how many people that we have come into the offices taking topical testosterone, their doctors don't even test their estrogen levels. it's literally crazy because high estrogen can cause heart disease, clotting, all these different things. And these guys are doing this stuff, but they're not getting managed properly. And that's just something we don't do at Buckeye. So strongly recommend, if you're going to go to someone that specializes in bioidentical like we do at Buckeye, and do it the right way. And the other thing we do at Buckeye that most people don't do, I don't know anyone in our area that's doing it, is we also give you HCG, which is very important. So, and any male on testosterone has to take HCG with it, which is human chorionic gonadotropin. And basically what this is any testosterone you take as a male, it works on a revert the negative feedback. So if you take testosterone, whether it's a topical, a pill, an injection, and you don't do HCG with it, your own body will quit producing over time. And we don't want that because you want your body to continue producing or produce more. So HCG, or the human chorionic gonadotropin that we prescribe, actually gets your own body to produce more testosterone. So we use that in conjunction, and if your levels are real low with the bioidentical, then that's the proper way to do it. So if you're listening and you're on testosterone replacement therapy somewhere else and you're not on HCG, you're wrecking your own endocrine system. You have to be on this product to keep your own production going. Very, very, very important. And as a side note, you were talking about, so you work for a company that does Vivitrol.
Correct.
Yeah, so explain this, because a lot of people, I don't even know what this is, and it's a really cool thing.
It's basically for people that are dependent on opioids or alcoholism. It's a once a month injectable that blocks the receptors in the brain and is used as a part of their treatment program to help hopefully one day to get them clean, to get them totally off the opioids and the alcohol.
Mm-hmm. Yeah, and the cool thing about this, and I know some about Vivitrol too, is that actually, if my understanding is correct, it actually helps curb the craving, because unlike like Suboxone is really like it's legal opioid, right? So, but this thing here works differently. It actually overloads the receptor, so you don't have the craving, and so you're really not on an opioid anymore.
Correct.
Right? Or alcohol, that is.
Yes.
Correct. And it's a good thing. So it's a solution to a problem. Instead of just giving a legalized version of it, it's actually a cure. Right. And the cool thing I've seen in some local, like I know a lot of the local drug courts now, if someone's incarcerated for, I know for opioids, I don't know about alcohol, they're actually, before they release them from jail, they're giving this Vivitrol. Because when you have a Vivitrol injection, you can't go out and go take more opioids, right?
Correct.
Because what happens if you do?
You're going to have a relapse. You're going to go backwards.
And you get sick, right?
Yes, very sick.
So, and unfortunately, these are the people that are addicted to this stuff, and opioids are the worst, man. I mean, and we can do a whole show on opioids, and, because, Buckeye was founded on the premises of non-opioid pain relief, and opioids are way overprescribed. They're still overprescribed. I know Ohio's up 30% this year in opioid overdoses. 30% this year. It's crazy, right?
It is.
And things like Vivitrol are a great solution for people. I think that the only thing I've heard, probably the hard thing for Vivitrol is you got to be clean for 7 days. Is that correct?
That is correct.
And it's so hard for some of these people to be clean for 7 days, especially the opioids.
Right. It's, especially, and the hope is that they can get there and use this product to get clean and stay clean. Mm-hmm. But, to add to that, it's like, when I broke this collarbone, I went for my checkup, and the first thing they asked me was, did I need more oxy? And I was like...
And bad people don't get hooked on drugs. It's not the person, it's the
right.
drug. You can take a good person, and they take this medication, and they're hooked. And my understanding is a lot of people say the first time they take it, they're hooked. Like, it's this crazy thing.
Yeah, it's very powerful. Like, I was just using them to sleep because I was, my arm was in a sling. I really couldn't move it. Mm-hmm. And, but after that, I was just like, my pain is okay. I'm just not going to use them anymore. So I just
But you're in this business, so maybe you might not, I'm saying
Correct.
You're in the business.
Correct.
So, all right. Well, hey, I really appreciate you coming on here today.
Thank you so much for having me. I really appreciate it.
Do you have any advice for some? So there's people who listen to the show all the time and they don't take action. What would you say?
I would say going through the things I've been through, I look at it to say to people, hey, get in there and try it. You don't have anything to lose. And if it works out for you, you're going to feel 1,000 times better. You're going to start looking better. And to me, life isn't a rose garden. You
never know when you could be gone. You knew that
firsthand. You never know. And it's like, don't wait to do anything. If you want to take a trip, take a trip. Don't wait, because, you may not be here. So, like I say, life is not hard, but, you owe it to yourself to give yourself the best life you can have. So I would say go in and try it. Give it a shot. You really have nothing to lose. What's the worst thing they can tell you? Hey, your levels look great.
Your levels are
Keep
great, and
doing
it
what
happens
you're
every
doing.
day. Your levels are fine.
Exactly.
Keep doing what you're doing. Man.
So, but I'm glad I did it, and I will continue to do it. And I really appreciate you having me on the show today.
I'm gonna have you on after the Ironman.
All right,
If you
we'll
want to
do
hold
it.
you to it, you gotta let me know, all right?
Yeah, I'll bring you a cup that says Ironman
Louisville.
Louisville finisher.
That's awesome. Good
That's
for
the
you.
goal.
That's awesome. All right, man. I'm going to hold you to it.
All right.
This is Dr. Buzz with Buckeye Physical Medicine and Rehab. Check out our website, buckeyepmr.com. Come in, get your blood work done. Talk to you soon.